I'm gonna try to make this real quick because y'all kind of getting on my nerves. I'm trying to go in here and give me a little wax, and y'all over here trying to get real disrespectful about this COVID stuff. I cannot stress this enough. As a nurse or as any healthcare provider, it is very atypical to see a person with an isolated medical issue. People do not die from the thing that brings them in. They die from side effects. You can look up the most common deaths in America, usually from medical errors, not from the condition themselves. Primary example is I had a relative who went into the hospital for cancer. He did not die from cancer. He died because he aspirated a feeding tube that was put down his nose to give him supplemental nutrition while he was healing from the cancer. If you have HIV, you do not die from HIV. You end up getting pneumonia or some sort of random infection in your body that kills you first. I've seen people who came in with AIDS who did not die from AIDS or from HIV, but their blood was so thin that they were bleeding everywhere, could not clot, that they practically died by bleeding to death. People who could not survive CPR because their ribs were cracking. So technically, no, they didn't die from HIV. That's not what goes on their death certificate, but that is what killed them. COVID is the same way. Hear me out when I say I understand that the government is doing a lot of crooked stuff. I don't put it past the government to be using COVID to fulfill some type of agenda. I don't put it past our government or any other government in the world creating this disease to fulfill some type of agenda. I don't put it past it being some sort of biological warfare, but that does not mean that it's not real. They are slapping COVID around on a lot of death certificates. I'm not saying that that's right, but I'm saying I do understand that the people who came in the units that I worked on with COVID patients, and let me mind y'all, nobody had to ask me to go into a COVID unit. I volunteered to go to the COVID unit where there was nothing but COVID. We did not have negative pressure rooms to protect ourselves. We didn't have a lot of things. We had so many beds stacked in one tiny room with no negative pressure. I volunteered to go into these areas and care for these people. Okay, so you talking to somebody who I don't give a flying fuck. And I'm telling y'all that a lot of times people die from things that are not COVID, but it's caused by COVID. So some of these people, I admit right now, are dying for something else and they seemingly slapping COVID on the death certificate. But if you catch COVID or you have COVID-like symptoms and then you randomly die, that was COVID. Y'all have to understand that when I was in New York, there was people who never made it to the hospital because they were dying in the ambulance. These people who were short of breath, and by the time they realized they were short of breath and wanted to come into the hospital, they were already sitting in the 70s. You don't come back from that. And I'm not talking about old people. I'm not talking about 80-year-olds. I'm talking about 30-year-olds who were coming in and wasn't making it 2 to 3 days in the ICU. They were dead with ventilation or without ventilation. Whether we put them on a vent or didn't put them on a vent. Whether we treated them with vitamins or gave them a Plaquenil, they were dying. So I understand that the government could be doing or probably is doing a lot of crooked stuff right now, but this is real. And y'all don't understand until you've seen a room full of people and none of them survive. You don't get it. And it's funny to y'all and you have time to sit around and make this some type of conspiracy and say that it's not real because you have not seen it. And I'm telling you, as a nurse, I have never seen COPD patients present the way that these COVID patients came. These are people who I could hardly even draw blood on because their blood was so thick. These are people who, when you draw their blood up to send it to the lab, it's literally black. I had never seen black blood like that in half the room. Literally 80% of the room, their blood was just coming into the tubes black. This is not your typical COPD. And the doctors were doing their best to treat it, but they didn't know how because it's not your typical disease. Come to find out, the vent settings that we use for people who have breathing problems, it didn't work for them. It did not work for COVID patients. We tried. You telling somebody who I tried. I begged and pleaded with these doctors every day. Let's try this. Let's try this. I read this. Everybody tried. And we don't know how to fix this. So when your family member gets sick and coming to the hospital, you understand that some people are going to give it everything they got and still not going to be able to fix them if it's too late. Some of this is genetic. Some people have dispositions to it. Personally, I think some people genetically are disposed to it for some reason because there was people, I saw older people who were like 80 years old and survived COVID, and I saw 30-year-olds die. So Yes, people are having heart attacks, and y'all are saying, oh, it's a heart attack and it's not COVID. It could have been just a heart attack, and it could have been COVID, because COVID causes microemboli, which is blood clots. Blood clots has a lot of different manifestations. When a person has a stroke, that's a blood clot that lodged in the brain. When a person turns blue from here up because they had a pulmonary embolism, that's a blood clot that stopped in their lungs. When a person loses their leg and they have to go in for an amputation, that's a blood clot that stopped in their leg. If a person has a heart attack, that's a blood clot that stopped in their heart. When a person goes into acute kidney failure with no pre-existing conditions, that's a blood clot that stopped in their kidneys. COVID causes microemboli all over your body. That's why people were dying in the ambulance before they could make it to the hospital, because they were short of breath. They got there, and before it was too late, they couldn't find out it was probably a pulmonary embolism or myocardial infarction, which is the same thing as a heart attack. So, y'all, this stuff is not black and white, and I understand that it is very upsetting, and it fills you with anger to know that the government is playing in our faces, but that still does not mean that we let our guards down. The South has been very, very fortunate. I don't know if it's what we eating, or if it's the fact that we spread out, or if we got some kind of genetic resilience to it. But the South has been very fortunate to still have your way of life, to still be able to walk in the store and sit down and eat. I just walked in a restaurant last night and sat down and ate. That's my first time being able to do that in 4 months. You understand? And y'all are playing. If somebody asks you to put on a mask, just put it on. Because you don't know what it's like being tied down and put in a medically induced coma. They paralyze you. Do you know what that feels like? I worked in an ICU that didn't even have the, we ran out of equipment because there were so many people sick. When you put somebody in a medically induced coma, you're supposed to have a tool that you use. You put it on a muscle and make sure that they're totally paralyzed so that the person is not freaking out. We didn't even have those tools. They were having to use their judgment to medically induce these people in coma and hope that they were paralyzed enough. But it was horrible. You imagine being tied down with a tube down your throat with your arms restrained, no food for 2 or 3 months at a time, for the chance to maybe live again, to maybe eat again and talk again, to walk again and see your family. Like, I understand the government is playing in our face, but y'all gotta stop. Seriously, you gotta stop spreading word, trying to make people feel like this is all a game. It's not a game. I don't know who created the virus, who put it here, what it's here for. I don't know what Trump and them are trying to use it for. I think it's bad that people are losing their jobs, not able to feed their families. This is horrible, but the virus is real. Have never seen manifestations like this. And if you're so certain that it's not real and that it's all fake and made up, I beg of you to come walk on a COVID unit with no negative pressure, with no mask on. I dare you. I dare you. If you have questions about COVID, then ask about COVID. And people who are out here saying all you got to do is eat right and it's going to keep you from getting it, that's not true either. There are very healthy people who caught it. And very much so. I have a very strong immune system. I have gotten the flu 1 time in my entire life. I have not had the common cold since high school. You understand? I got miserably, deathly sick back in February. So whatever the hell is going on right now, it's not typical. And you're talking about a person who eats organic, fruits and vegetables, cuts my sugar, exercises, and I still got so sick back in February that I thought I was dying. So it's not immune. If you have a superb immune system, then that means that you might not have as many symptoms as the next person. It does not mean that you won't catch it. And if you catch it and you're asymptomatic and you pass it on to a relative, then you just put your mother, your father, your grandparents at risk. Know that. Just because you're not symptomatic, that doesn't mean anything. Okay, and people who are saying, oh, well, I never get sick. No, you never are symptomatic. You catch the same stuff that everybody else catch. You just don't have symptoms because your immune system is souped up. But please don't go passing that around immunocompromised people. Black people have the highest rates of heart failure, COPD, obesity. We cannot tolerate catching this shit. You understand? Like, you saying that you good because you work out, but your mama don't work out. So wear a mask for her. That's all. Thank you. If you have any questions, put it in the comment. If you need any clarifications, I'll go live again earlier. But I'm being very disturbed. I am so happy to be back home, but it really saddens me to see how many people are not taking this as a reality or trying to say it's not fake when I lived through it. I lived through seeing them tote bodies out by the day. I lived through seeing refrigerated trucks parked outside of our building, filled up with bodies because there was a morgue across the street that they didn't have room for. There's no room in the morgues. They are full. So it's not a game whether Trump did it or not, whether somebody from China did it or not. That's beyond us now. The reason why it got here and what they're trying to use it to fulfill whatever agenda, that's another issue. If you want to go protest on the laws, protest on the laws. If you want to protest for unemployment, for work from home jobs, for some kind of guaranteed income because computers are taking over our jobs, then protest for that. But please stop saying the COVID is fake. That is all.